Michelle, you work for the American Cancer Society, and you're the one person up here who is not a transportation provider. Can you just tell us a little bit about what the American Cancer Society does and how that has now come around to having a transportation program there?
Well, certainly. On the broader scope, the American Cancer Society does a lot of valuable research, provides funding for key cancer research. We do a certain amount of a lot of prevention and detection efforts to really help people assess the risk for cancer. And then there's also the issues that are under what we call quality of life. When someone is diagnosed with cancer, what do they have to do to receive the treatment that they need? How can we help them with a wide array of issues that they might confront now? And transportation, access to treatment, has been one of the key barriers that our cancer patients have seen. I would say in the last 10 years, that importance, that issue of transportation for cancer patients has increased, and it's now one of the top two barriers to actually getting the treatment and one of the top two financial concerns of a cancer patient. Just because of the chronic condition of cancer and the recurring treatment that a cancer patient would go through, much like dialysis, where it may be every day, Monday through Friday, for 4 to 6 weeks, that can really take its toll and completely change or help completely change that cancer patient's financial picture. So we were very interested in doing all that we could to try to address that barrier and make sure that everyone could get to the treatment that they were so in need of. In terms of this project, the Cancer Society, as it was mentioned earlier, we do have some great volunteer programs such as Road to Recovery. Road to Recovery is very successful in some urban areas, most successful in suburban areas. And then when you get to rural areas, it can be moderately successful. The issue we were facing in South Dakota was extreme frontier rural distances in which it was about 200 miles one way. And if you look at the state of South Dakota, all of the key treatment centers are on the eastern or western edge. It's mostly on the eastern edge. There's one on the western edge. So that means that patients are isolated from their treatment center in a much more dramatic fashion than elsewhere. And the idea of free transportation, well, it's an expensive program. And so we're trying to figure out a way that we could really help get those patients that were isolated to the treatment that they so needed.